So now next we're gonna look at internal bleed, post-operative bleeding. A patient who had an operation, okay, and is bleeding after the operation. Yeah, intra-abdominal bleed. So presenting complaints very commonly is shortness of breath. Okay, so this patient had an operation 1 hour, 2 hours ago. The nurses are worried about the patient and they've asked you to assess the patient. The patient is feeling unwell, and you tell the doctor, I can't breathe again, like many of the scenarios, doctor, I can't breathe. Okay. So, hello, Mrs. Brown, how are you doing? Doctor, I can't breathe, please help me. What do we say? Since the patient is talking, the airway is patent. Then we go to B. We look at the monitors. We look at the respiratory rate and oxygen is low. So what do you do as usual? We give you oxygen. We do it for real. Then the window is open to take a history of shortness of breath. Then the differentials, the same as discussed before. The PE, the pneumonia, the pneumothorax, the asthma, the COPD, the heart failure, pulmonary edema, and of course the MI. Yeah, you finish the history, then specific history. The patient had an operation. So you have to ask, what operation did you have? When did you have an operation? Was there any complications? Okay. So what you're going to do is to check the postoperative notes. So you're just going to say, I will have to check the notes, the postoperative notes, to see what operation you have, if you had any complications. I also look at the drug charts to see if you've been giving anything that could cause the problems, and also look at the general notes as well. So we just mentioned any patient postoperatively, we review the drug chart, we review the post-op notes. Now I need to examine you. You examine the patient respiratory. Okay, what you're going to find? Normal, because it's an intra-abdominal bleed. Is there anything to manage immediately? No, because there was nothing. Now, oxygen was low. He is short of breath. You still need to do an ABG, a chest X-ray. What did we say how we do it? Okay, Mr. Brown, I just need to arrange some tests for you, a chest X-ray and an arterial blood gas. Okay, good. Now, I need to assess your circulation. Your blood pressure is low. Your heart rate is high. I can see the monitor shows a sinus tachycardia. It simply means your heart is working faster than usual, Mr. Brown. Capillary refill, you have to do it, pressing on the chest as we discussed. Okay, so we're going to assess the same as normal as usual, auscultating for the heart. Okay, so what you're going to do, auscultate on one position only. Yeah, nothing suggesting heart problems. You can examine more if there is suggestion for such. ECG, you need it because it's post-operatively. You have to do abdominal and external genitalia examination now. Let's manage. Get an IV line, send the bloods, routine, group and save, cross-match. Give IV fluids, how much? It's bleeding, we're suspecting. So what we're going to do, aggressive IV fluids, 1 liter normal saline in both arms. Then we go to D. On an AVPU system, my patient is what? Alert. PP normal. Review the treatment. What have we done? We have given oxygen at B and IV fluids. We find the blood pressure has improved 110/80. So good improvement. We have sent for cross-match. So there's no need of rushing to give group O blood when the IV fluids have maintained and sustained a good blood pressure of above 90 systolic. Okay, so then what we go next, we go to E. Now, because it is post-op, we have done abdominal and we have done external genitalia already. So just gonna look at the legs, palpate on the calf and on normal. And we have seen that the blood pressure is stabilized. So we're gonna talk to the patient, okay? Now, what you're gonna find on examination, when you do an abdominal examination, patient is gonna have in pain because of course it's post-operatively, yeah? Here, when you're doing an examination here, just gonna go back slightly, it's post-operatively, yeah? It's gonna be in pain. When you inspect it, what there will be there? If it's post-op, there will be wound dressing, and you palpate, there will be pain, you scream in pain, okay? Good, so management. We take easy and calm and explain to the patient, okay, Mrs. Brown, I have assessed you, okay? You had shortness of breath and you've not been feeling well generally. You had an operation about an hour ago, okay? When examining you, of course, you're in severe pain in your tummy, your blood pressure was very low, okay? I am suspecting that the cause of your problem, the cause of your low blood pressure, your low oxygen, is you could be bleeding inside your tummy, Okay, you may have what we call an intra-abdominal bleed as a complication of the operation which you had. What I need to do, we need to keep monitoring you. Okay, we'll keep monitoring, continue the IV fluids, continue the oxygen. I need to discuss with my seniors. Okay, you might need to go back to theater to have another operation to see where you're bleeding from and stop the bleed. Okay, to see where you're bleeding from and stop the bleed. Okay, so that would be our management of this particular case.